So, welcome everybody to the video. Welcome dr.Neal Rouzier and Angie Nichols.
Please like and subscribe. Thank you.
And hit that notification bell so you won't miss anything. How are you guys?
We're fine, thank you. Thank you, Steve.
So, for everyone looking at this video and who wouldn't already know, dr.Neal Rouzier is an MD and an expert in hormone replacement and balancing, and on top of the research about health, exercise, and the aging process. He has been training a lot of other doctors in the field of hormone optimization therapy, and one of them is our good friend, Dr. Het Nichols. So I understand you have trained a lot of doctors, but also a lot of nurses. Is that right, Neil?
Yes, absolutely. We probably have trained, several thousands of physicians, but also probably 50% nurses that attend the meetings also. And as I'll later get into with Angie, sometimes the nurses grasp it better, explain it better, are more passionate about it than physicians. Which is why, Angie is doing this interview as opposed to any physician. And we'll get into that later when I further introduce her. So yes, I've been teaching this for 25 years, teaching courses to physicians throughout the United States, throughout the world. And I spend, it's now a full-time and a half job teaching and training doctors and nurses and nurse practitioners and other practitioners on the science and techniques and art of doing it.
Okay. And of course, I've seen you in other podcasts, but are you still doing daily practice with patients that contact you directly as well?
Oh, yes, I am. Whenever I'm here, whenever I'm home, which is about maybe 1 or 2 days a week on the average, because I'm, pretty much gone most of the time. So patients do have to schedule well in advance because, I just don't have time to see patients, do the practice, teach, travel. It's just too much. So I spend most of my time now not seeing patients, although I still do, but most of my time is doing research and or teaching.
Mm-hmm. And what kind of research is that exactly? Is that clinical studies or what is that exactly?
Well, the clinical studies based on the results we see in our patients, but more so is just review the literature and putting it together for lectures and papers that I will write.
Mm-hmm. Okay, very interesting. And how did you come into contact with Angie? Was she one of your top students maybe and you held contact with her?
Well, it's sort of an interesting story, and I think probably everyone needs to understand this as to why I'm introducing Angie and why she's doing this podcast as opposed to you, me, Keith, or any other physician, because you would typically expect, physicians to do these podcasts because, they've got the MD behind their name. But unfortunately, just because they have an MD behind their name does not mean that they're adequately trained, qualified, well-spoken, or have experience in the field. And I find it very interesting that, I don't know if it's because nurse practitioners are mostly female. I don't know if it's because, they just take more of an interest into it because they're female and they can relate to hormones. But in my experience, a nurse practitioner is a lot more fun to train and teach. But in turn, it's the nurse practitioner that I find that probably is the most well-spoken, passionate, and eager to do this. So how did I come to know Angie? Well, Angie came to one of my conferences along with her husband, who's a physician. And, she sat there and listened to every word that I spoke and gobbled it up and processed it well. And it was sort of odd, I can be intimidating when I lecture and train people. And a lot of people don't want to approach me because they find that I'm intimidating, although, in real life, I'm not. But I ran into Angie in an elevator and she asked me this question. And I gave her an answer and she responded, and her response was like, I can't believe her response. She has so much insight She has a lot of experience. She has a lot of passion, but she was so well spoken on the subject matter that it sort of surprised me. So I got back into the lecture and started talking, and I said, you know, I encountered this conversation with a practitioner, and I would like that practitioner to stand up and explain what she did to me so that everyone else could understand what flows out of her mouth is so eloquent and so true. And I typically do not see that in physicians. And so I said, you know, of course, the audience is going, well, who is this person? So I said, Angie, stand up and talk. And of course, she was like, oh my God, it's me. You know, don't put me on the spot. Wait a minute, I can't get up and speak to a whole group of physicians. Oh yeah, you can. You know, just you know, we're all the same. We all want to help patients. We all want to learn the subject material. So then she, you know, she started speaking, and that's sort of what started our relationship. Was that it was, if it wasn't for her talking with me in the elevator, and it wasn't for me having her get up and speak in front of a large group of physicians on hormones and what her experience was, and to sort of teach us and show us that, you know, what a lot of you doctors out there are doing is not necessarily correct. And you need to understand this better. You need to understand what works. It was like, here this nurse is standing up and telling the doctors what works. Well, as you know, Stephen, way back in your training and my training, who taught us the most? It was the nurses. It was the nurses in the hospital. It was the nurses everywhere else. You know, it was like, you know, the nurses sort of took us by the hand and taught us and trained us. And so, you know, my heart goes out to all the nurses that have educated me over the years. And my heart goes out to Angie because she's educated so many patients that would otherwise not be as educated as it would be thanks to her. So that's what started my relationship with Angie. And since that time, you know, we communicate probably, you know, on an every other day basis, and she sends me cases and problems and questions, and I send them back. And she has such insight and such, the best way I can explain this in simple terms is she gets it. She grasps it. Physicians don't always grasp it. Well, that's not the way I was taught or trained. Well, that's not right. You know, the numbers are too high. The levels don't make sense. And her point of contention is, well, we really don't care what the number is. We care that the patient feels better and that the patient's symptoms improve. She's an expert at that, which is why people gravitate to her, which is why she's doing the podcast, because she has tremendous, let me use the term, more experience than most physicians, and has a lot more insight into what works and what works for both men and women that most physicians don't know or understand. And she's more than happy to explain. Her husband didn't know or understand this at the beginning either. Now he does. But Angie really understands it. She really gets it. And so it's a pleasure for me to introduce Angie Nichols. Sorry for the long-winded introduction, but I think it's, you know, it's due. And I think both men and women that are listening to the podcast need to understand, you know, why we're interviewing her, because of her tremendous insight, experience, passion, desire, and lack of fear of treating patients to get their symptoms improved, as opposed to we doctors simply worrying about numbers.
Mm-hmm. Okay.
So, Angie, the ball's in your court.
Gosh, that is so kind of you to say. I really appreciate all of your kind words. And I appreciate everything that you have taught Keith and I over the last 10 years, because it has helped us grow in what we do. It's helped us grow in our understanding. And when we first started coming to the courses, you know, we were just really looking to try to get help for ourselves because we could not find anybody to address what we were going through. And so we had traveled the country and tried to find doctors that could help us, educators that could help us. And when we went to Neal's courses, it was like, wow, this guy really knows, because you had all the literature to support. I mean, we were overwhelmed by the amount of literature. And I think that that's what people that attend Neal's courses the first time or two leave with, like, wow, there is just so much literature that supports what he's saying. Why is this not a standard of care? Why is this not common? Why are there so few of us? And it's what's made what we do fun, because it works. It really, really works. Yeah, well, Keith has poked his head in to tell us. And of course, we snuck away from one of Neal's courses. It was in Las Vegas, I believe, on a Sunday, and got married. So, of course, there's always going to be that special connection too.
Wonderful. Well, yeah, you talk about the course, you talk about the literature, you talk about the overwhelming literature support as to what we do, and the amount of material in the courses. But the bottom line is, what has that done for your patients?
Oh, it changes.
That's the key.
Yeah, it changes lives every day, and that's what makes it so fun. And it's at any age. When patients come in their 40s or 50s or 80s, it's the same response. Patients respond pretty much the same across the board. You just increase the hormones until the symptoms go away. It seems very simple now. It wasn't in the beginning, but you just.
How long did it take Keith to learn that?
Well, it took a little while.
Yeah, sure. Yeah, with time and experience, you learn what works. Anyway, go ahead. Yeah, sure.
And I think that doctors maybe, like you talk about, have more confirmation bias because you're trained so rigidly, about staying within numbers and guidelines. And, I've thought about this a lot when we were talking about doing the podcast. And when you say that, it's more fun or it's easier to train nurses or nurse practitioners, I think that goes back to, we're trained very much in problem solving and approaching each patient as an individual. And it's sort of intuitive that we understand that what works for one patient isn't going to work for the next patient, because we are all so unique and different. And so that's something that really hit home with me is that, one patient may feel great with a testosterone level, say at 900, and it may take someone else being 1100 to feel their best, so there's no cookie cutter way to do this. You just have to listen to what they have to say. And Neal used to always say too, if you listen to your patients long enough, then they will tell you what the problem is. And if you listen even longer, they will tell you how to fix it. And that is so true. If you will just take the time to listen to what your patient is saying, then you'll get it.
Yeah, the trouble is physicians are stuck, one, on not listening to the patients because we don't have time. I say that sort of tongue in cheek. And secondly, we're stuck on numbers. And when the number gets to 900, you say, okay, well, I can't go any higher. And you go, well, wait a minute. The patient goes, well, what about my symptoms? And the doctor says, well, we really don't care about your symptoms. We care about the numbers. And the patient says, yes, but my friend feels well, and but I don't. Well, we can't raise your dose any because your numbers, your levels, and I've not met a nurse practitioner that's walked up to me and said, I'm afraid of a number. What I'm afraid of is not improving the symptoms, and that's why nurses get it. That's why nurses grasp it, and physicians don't, because physicians are stuck on numbers. We have a confirmation bias against it. We have a confirmation bias about going outside of that range, and that range is an average level of old, sick people, and we don't really know what or understand what normal means. Normal's not optimal. Normal's not where you're going to feel the best. Normal's not where you're going to function the best. But normal is an average of old, sick people that's printed on a lab page, and we don't want to go above that number. But as you found out, Angie, and Keith certainly found out, that doesn't dictate what's going on at the cell. The cell doesn't look at numbers. The cell looks at the amount of receptor sites that are saturated to help improve symptoms. And you know how to treat those patients, and you listen to them. This is what I've got. Okay, they're telling you what's wrong. Angie goes, okay, well, this is how we fix it. And you're not handcuffed by numbers, whereas most physicians are, and we're stuck, which is why, again, I hate to say it, nurse practitioners aren't stymied by that. Dr. Kadambi, world famous endocrinologist in Indiana, employs about a dozen nurse practitioners, and none of the nurse practitioners have any problems or issues with numbers. The nurse practitioners have problems and issues with, my patient's not feeling better, so I need to increase the dose. And it took Dr. Kadambi a while to accept that and understand that, because he still has this confirmation bias, whereas the nurses go, no, I feel perfectly comfortable with it. This is what I do. This is where patients feel better. And that's exactly what you do, Angie. And taught many physicians, you know, in the courses, when you stand up and say, you guys don't get it. You don't get it. You still don't grasp it. You don't understand what works. And we come back with, yeah, but the numbers. And you come back with, forget the numbers. Get away from the numbers. Treat the patient. The patients will improve. And there's a multitude of different things that will improve when you optimize those numbers. I should say optimize those levels.
Okay,
So there you go.
very nice words, Neil, about Angie. And it was the idea of Keith actually to start a series of podcasts on female hormone optimization. And since I myself, I am very interested in that as well, as a lot of other men in our Facebook group are as well, and women, of course. So we have to get to Angie a bit more before we start those podcasts. So Angie, how long have you been in the field of hormone optimization now, and why were you attracted to it in the first place?
Well, I've been a nurse for over 25 years, and we have been studying hormone optimization for a little over a decade. And the reason that we got interested in it in the first place was because, well, for me, I was around 36, 38. I started having some symptoms. It was fatigue that I had never had before. And I was working as a school nurse at the time. And my patients just kind of lost me. It was like an irritability that I had never experienced. And I thought, this is not me. Something is wrong with me. But it was the fatigue, really, and the irritability. And so I went to the doctor. He was a GYN. And he said, Angie, let me tell you, everything that you're explaining to me right now is hormone related, but I don't have time to learn all that. I'm busy delivering babies and performing hysterectomies. And I thought, wow, you know, I appreciate your honesty, but if a gynecologist can't advise me on hormones for women, who in the world can? And so I started trying to figure it out, just as Keith, he's told his story, and it was a similar experience for him. He was told, you know, we're just getting older. This is what happens, you know, and we weren't ready to accept that. So we started trying to figure out answers and things that could help us. And then, of course, once we found those answers and we saw what a difference it made, you know, we wanted, the natural thing was to want to share that with our friends and our family, and then extend that on to our patients. And when we saw what a dramatic change it made in their lives, you know, Neil talks about also in the courses, you know, he's saved all kinds of lives through the ER, and nobody ever comes back and really says, wow, thank you so much for saving my life. But it's regularly that we get calls or cards or emails from patients going, wow, what a tremendous difference you have made in our day-to-day quality of life. And so that's what makes it fun. And it was just our personal experience, really, that led us down this path.
I'm glad that you got to experience it yourself. And as you've heard me say, and you've heard many other practitioners say in the courses, it wasn't until they did it themselves that they saw the difference. It wasn't until they did it themselves or on their staff or their significant other, their spouses, that they saw the difference. And when they finally saw and felt the difference, it was like an epiphany of like, okay, now I get it. I don't understand why I didn't get it, but I didn't get it until I truly felt it and saw it. And then when I felt it and saw it, now I understand. But I didn't understand it before. I didn't grasp it because it didn't make sense, because that's not the way that we were taught and trained. But once somebody feels it and sees it like you did and Keith, it's like, okay, there's no turning back. We have to do this. We have to share this with the world, which is my passion for teaching, as you know.
Mm-hmm. And does it seem logic that men, because of their own experience, are more interested in male hormone optimization, and women, as you, Angie, are more interested into female hormone optimization, or does that crosses over?
Well, I'll answer for Angie first. Angie always says to me, you know, when we make the wives feel better, they drag in their husbands. In my experience, when I can make the husbands feel better, they drag in their wives. So it's a team sport, and it's interesting that all you have to do is make the spouse feel better, if it's male or female, and they will then drag in their spouse because they want their spouse to feel better also. So yes, it's important for women. Yes, it's important for men. But when men bring in their spouses and make them feel better, and women bring in their spouses and make them feel better, it's a win-win for everyone. And Angie's really good at doing that. She's got lots of stories about, you know, all of the wives that bring in their husbands, drag them in, you know, and of course, you know, the poor guys don't know why they're there. And it's suddenly when they feel better, it's like, oh my God, now I see what you're talking about. So anyway, go ahead, Angie.
It's just fun for me. I mean, as far as women or men, for me, there's no preference. It's just, you know, getting to see people feel better, male, female, whatever. You know, they just feel better. It's quality of life. That's what makes it fun. That's what drives me to get up every morning and do what I do every day and try to study and continue to learn more. You know, male, female, doesn't matter.
Mm-hmm. Yeah, I'll probably also say, you know, in these courses, Steve, that I teach, they're pretty intense. And probably most people, once they take one of the courses, they will, you know, 75% go back and take it again. 50% will go back and take it 3 times. I think Angie and Keith have taken it several times, and each time they take it, you know, you learn more and understand it, you know, even better. And it's a 4-part series of courses, and Keith and Angie have attended, you know, many of these 1, 2, 3, and 4, you know, back to back. So they're really intense courses, and the presentation of the data in the literature is, you know, sometimes overwhelming because it's so much that you have to sort of take it again in order to take it all in. But, you know, with all of that data and with all those studies, like Angie said earlier, you use the evidence-based medicine to practice what you practice and why, and you use that data to support why you do what you do. And most physicians are not aware of that data. It's just, it's something that slips between the cracks. There's no venue, there's no medical academy meeting that they can go to learn this. There's no place that they can go to. There's no book that they can read where they learn all of this. So this is pretty much the only venue that physicians have for learning the material. But even then they come in with, you know, well, that's not the way I was taught, until they finally do it. And when they do it, it's like, it's an epiphany. And then we have practitioners like, you know, Keith and Angie taking the ball and running with it and going, you know, it's changed our practices, it's changed the lives of our patients, it's changed our lives. You know, there's no looking back.
Okay, I'm a bit curious for Angie. In daily practice, how do you manage seeing patients? Because in Belgium, as being a nurse, you can only do what the doctors tell you in clinics and whatever. But I hope that in your daily practice, you can do more than just that you see patients as well. But of course, you can't write prescriptions. Is that right?
Right. Yes, that's right. Every prescription that is written, Dr. Nichols writes that. I do a lot of consultations with patients, and I can provide education. That's one of the big things that nurses always do, is provide lots of education, and that's one of the things that I enjoy most. So I do meet with patients, do consultations with patients every day, but ultimately the prescriptions that are written, those all come from Dr. Nichols.
Mm-hmm. Okay, very interesting.
Things like that. And orders lab work, and we follow the lab work and review all of the patients. Of course, you know, he's looking at the data and then I'm telling the story. So it kind of fits well together because, you know, it's like, okay, well, here's their number. Okay, but they're still having this problem. Well, if we maybe go a little more here or a little less there, maybe we can fix that problem. So it really is a team effort on a daily basis.
With all due respect to Keith and me, in my practice, we have an Angie also whose name is Carolyn. And it is Angie and Carolyn that are the central hub of our practices and make the wheel roll. But in spite of the fact that Keith and I know the science and literature, it's Carolyn and Angie that educate the patients. And when the patient calls back with an issue or a question, they don't ask for Keith, they don't ask for me, they ask for Carolyn or Angie. Because they bond with them, because, you know, Angie and Carolyn know so much about this and can relate and educate and teach, whereas we physicians, again, all due respect, you know, we're just not good at it. You know, we may know the science or the papers. We're not good at teaching. We're not good at the day-to-day interactions that the nurses are superb at. So, again, the reason Angie is here and not Keith is because Angie's the educator. She's the one that everyone bonds with. People don't call in and ask for me. They call in and ask for Carolyn. They don't call in and ask for Keith. He knows the material. He's a really nice guy. They want Angie. It's Angie that they make the bond with.
Okay.
Isn't that right, Angie?
Keith has sitting here telling, yes, that's totally true. He's looking in every now and then. He's like, he totally agrees.
Hey,
Okay.
it's okay, it's all right. It's all right to have you guys. If you do a much better job than we do, then so be it.
So starting next week already, Angie and I are doing this podcast on a regular basis, and we'll start with all kind of questions about estrogen, progesterone, testosterone, especially for female hormone optimization. And why do you feel, Neal, that Angie is the ideal person to do this kind of podcast with me?
Because there's nobody better. I don't know how to say that in a nice way. No, she's, I think if physicians were listening, they would go, okay, well, she's a nurse. When patients listen, they go, okay, I want the nurse, I don't want the doctor. And once you start to listen to Angie and her insight and her passion and her stories and her command of the material, you'll go, no, I really don't need the doctor. I would rather much have Angie, which is why she's doing the podcast for women. I think she can relate better to women. I think she understands the material better than most doctors. And she's probably just as well-spoken, if not more well-spoken than most of the doctors that are experts. You'll hear that as you start to interview her, and you'll know why she's doing it as opposed to anyone else. And then you'll come to understand. Yeah, she knows it. She's good. Again, with all due respect to the physicians, nurses do it better. And Angie's on the top of that list.
Well, I learned from the best.
Okay, so we're looking forward to that. So anything more you want to add to that, Angie or Neal?
Well, I do. How long did it take you, Steve, to get good at dermatology? You learned it, and then you thought you knew it when you came out of your residency, and then you practiced it for a while. But with time and experience and maturity, you'll go, okay, what I know now is so much different than what I knew then. I thought I knew it then. I thought I was good, but 10, 20 years later, you go, okay, now I know so much more, and I have a much better grasp of the material, but also much greater grasp of dermatology and the science and the literature and how to do things.
Yeah.
That only comes with, we say in racing, seat time. The more time you spend in the seat, the better you get at racing. The more time you spend in the seat as a dermatologist, the better you get. Me as a emergency physician, the better I get. And Angie the same way. Well, Angie's been doing it, like she said, for well over 10 years. She's been to all the courses. She's listened to the webinars and the journal clubs that we give. She's had tremendous patient experience. So speaking from experience, she's probably, has more experience, more insight, more exposure than most physicians do, which again is why she's doing the podcast. So it's her experience, plus her personality, plus her insight, plus her passion, that drives her. But insofar as experience, I think that it is worth its weight in gold.
Okay, Angie, are you looking forward to our podcast the next few weeks?
I'm very excited and looking forward to our podcast.
Okay, great. I will act as if I know nothing about female hormones, and that's not far from the truth, actually. So I'm looking forward to that as well.
Yeah, it's something that you, Steve, and I were not taught in our training. So, we'll sit back and we'll listen to see what Angie has to say. It'll be enlightening.
Yeah, sometimes I have female patients with hormonal problems. I see it on their skin because of acne breakouts, melasma, discoloration of the skin, whatever. And so I always tell them, well, you have to go and see your gynecologist to talk about your hormones because, that's their field, but I guess not, right?
Yeah, and the gynecologist says, no, you have to see the dermatologist. And the dermatologist says, no, you got to go see somebody else. And somebody else says, you got to go see somebody else. You have to go see the endocrinologist. Yeah, and everyone sort of gets shuffled around because none of us really have the experience and expertise that we need to in order to address those issues.
Maybe that's one interesting question. Why is the endocrinologist not the expert in this matter? Why is it always other kind of doctors?
That's the $1 million question. If you can answer that question, you'll get the Nobel Prize in medicine. The problem is that the endocrinologists are taught differently. What endocrinologists do is they treat a true deficiency where the level is really low, and then they bring you up to the normal range. Well, the normal range, again, is an average of a population of old people. What we do is different. We bring your levels up to optimal. There's a difference between normal and optimal. The endocrinologist will bring you up somewhere in the low normal range and say, well, that's fine. We'll say, no, that's not fine. That's not adequate. What we need is a lot more. And that's why we use optimal. Well, what numbers do you use? The endocrinologists use numbers. We use symptoms and signs. We look at not the numbers. We look at patient improvement symptomatically, the signs, the blood pressure, cholesterol, blood sugar, waist circumference, strength, energy, mood, depression. We look at all of those factors in guiding our therapy, not a number. Because if you use just a number, as all the studies show, normal is not optimal. You can have perfectly normal numbers and still be symptomatic, and the only way to improve those symptoms is to raise the hormone levels. And that's what physicians are not good at, but that's the difference.
Mm-hmm. Okay. I know that Keith always says we have to optimize all hormones, not just testosterone or thyroid, for example. Are we going to talk about that as well, Angie, about DHEA, pregnenolone, melatonin? Are you guys trained in those hormones as well?
Absolutely. Absolutely. I use the analogy with a car all the time. You know, the body is a finely designed machine, just like a car. And you couldn't only put gas in your car. You've got to put oil and transmission fluid and brake fluid. And our hormones are like that for the body. So we need them all just like a car needs all of those things.
Okay. You agree with that, of course, Neal?
I like her male analogy. When you start to talk cars, then okay, now we grasp it. Yeah, we get it.
Okay, so I will thank you both so much for this nice introduction to Angie's future podcast with me about female hormone optimization. I already have a bunch of questions ready for her for the next few weeks. So thank you, Dr. Neal Rouzier, to endorse her. It's so nice of you.
My pleasure.
Okay, so thank you so much, and talk to you next time.
Thank you, Steve. Thank you, Angie. We'll see you at the next podcast. Bye-bye.
Okay, thanks, and bye-bye.